Juvenile rheumatoid arthritis. Juvenile rheumatoid arthritis, or JRA, is also known as juvenile idiopathic arthritis, or GIA. Throughout this presentation, I'll be referring to this disease as GIA. GIA is a childhood form of rheumatoid arthritis. It is characterized by chronic arthritis in one or more joints for at least 6 weeks. Approximately 300,000 children in the United States have some form of arthritis. GIA affects 50,000 children in the United States. This type of arthritis is different from the adult form of arthritis. No specific diagnostic tests have been developed, so the actual number of children with this disease may be higher. The age of onset varies. A child as young as 6 months may be diagnosed with this disease all the way through the age of 16 years of age. Symptoms include joint pain, joint swelling, joint stiffness, joint deformation, limited range of motion, fever, rash, fatigue, weakness, anorexia, and weight loss. There are 4 main types of GIA. Oligoarticular, which affects 30% of the patients with GIA. Polyarticular affects 25% of the patients diagnosed with GIA. Systemic affects 5% of the patients affected with GIA. Enthesitis-associated affects 25% of the patients affected with GIA, and this type of GIA interferes with the connective tissues between the tendons or ligaments and bone. There are also 2 subtypes of GIA: psoriatic arthritis, which affects 5% of the patients with GIA, and undifferentiated JRA affects 10% of the patients affected with GIA. Oligoarticular, or ligio meaning fewer, is a type of arthritis that affects 4 or fewer joints of the body, usually affecting the medium to large joints. In many cases, a patient will experience leg length discrepancies. Polyarticular arthritis involves 5 or more joints. Both large and small joints are involved. In many cases, rheumatoid nodules are developed on the body at pressure points, and patients with this type of GIA will also experience anemia. The systemic form of GIA can affect any number of joints, both large and small. Patients with this form of GIA may experience spiking fevers, where the body temperature rises very rapidly and then very quickly lowers. A rash is also accommodating with this type of GIA, and the rash will also appear very rapidly and then disappear very quickly. Enthesitis-associated form of GIA typically is associated with the lower extremities, usually the large joints. The high mark of this form of GIA is the inflammation of the tendinous insertions. This type of GIA creates low back pain. In many cases, patients will experience Crohn's disease and colitis. Overall, females are more affected than males. However, the enthesitis type has found to be a little more common in males. There's equal ratio between Caucasians and African Americans. The real known cause of GIA is unknown. It has been found to be an autoimmune disease, the process that is brought on by specific environmental or genetic factors. An autoimmune disease is when the white blood cells can't tell the difference between the body's own healthy cells and germs, such as bacteria and viruses. Some of the environmental factors that have been found to be influencing factors towards a patient being diagnosed with GIA are related to early diseases or interuterine environments, such as maternal smoking and children with serious infections early in life. There has been an increased risk of these type of patients being diagnosed with GIA. Some of the genetic factors, a few studies have pointed to 2 specific genes that are associated with this illness. This disease carries some serious complications. Eye problems such as eye inflammation or uveitis can result in cataracts, glaucoma, and even blindness in children with GIA. Growth problems can occur, A child's bone development can be interfered due to GIA, and the types of medications used to treat this disease can also inhibit bone growth. Some of the treatments for GIA include medications, physical therapy, and exercise. In many cases, children will need surgeries. Corticosteroid injections and steroids have been known to be successful for treatment, and immunosuppressive therapy has also been found to be one of the types of treatments used to treat GIA. Healthcare providers include primary care physicians, physical therapists, rheumatologists, and these professionals all need to work together to develop a treatment plan for a patient with GIA. The main goal is to alleviate pain and inflammation, to slow down and prevent the destruction of joints, and to restore the use and function of the joints to promote optimal growth, physical activity, and social and emotional development. Juvenile arthritis causes a variety of inflammatory diseases, leading to erosive arthritis in children. This can lead to a child becoming disabled. Children experience limited range of motion, weakness, and deformation. Children with early disease onset have a greater number of restricted joints and have a higher risk of developing long-term physical disabilities. The risk of visual loss also increases in children with early disease onset. Knowing that many children will become disabled and develop vision loss, the quality of life on children with GIA has been greatly affected. GIA has a great impact on not only the patients diagnosed with GIA, but also family members. Parents need to understand how to cope with the demands of caring for a child with GIA. The family structure is often interrupted. There's frequent visits to medical professionals. There's different treatment regimes that also interfere with the daily functioning of families. It's a very unpredictable illness, and many parents, as well as patients with GIA, will experience sleepless nights. Due to the impact of GIA, education is also interrupted. Patients with GIA have pain and also, in many cases, vision loss or interruptions or loss of vision. This requires many doctor visits, and of course then school absences will rise. Due to patients being affected with GIA, they do miss a lot of school according to research, and this can create an inferiority complex in many students. They're also lacking school involvement, and once this occurs, the dropout rate of children with any type of illness increases, as well as literacy has been declining with students with GIA. In summary, juvenile rheumatoid arthritis is a childhood form of rheumatoid arthritis. The disease is very difficult to live with. The causes are unknown. There have been links to environmental and genetic factors. The disease is very painful, can cause the body to have limited mobility, also vision problems. There needs to be a highly qualified team to care for patients with GIA, working together to form treatment plans to help alleviate pain and to increase mobility. GIA also affects the education of patients with this disease because the disease needs so much medical attention. Students do miss a lot of school, and therefore their social as well as academics will suffer. And again, GIA has its effects on the home life. Many parents and family members living with a patient with GIA will have to experience the numerous doctor visits and interruptions in the daily life schedule. Here's a few pictures of patients with GIA. The top figure on the left, figure 5, shows the rash of a patient with systemic onset disease of GIA. You can see on the belly, you see some red marks and a rash. And remember, this form of GIA, a patient will experience, the rash will appear very quickly, along with a high spiking fever, and then the rash and the fever will also go down very rapidly. If you look to the right, you see a temperature chart. This is an example of how a high spiking fever can occur with a patient with the systemic form of GIA. you can see how the temperature spikes and then rapidly decreases. If you're looking at the lower left-hand corner, there's a picture of a patient with oligoarticular form of GIA, and you can see the difference in the right and left knee, where the right knee is showing swelling, and you can see how there seems to be some deformation in these ligaments. And in the lower right-hand corner, this patient has polyarticular form of GIA, and the joints in the wrist and hand are inflamed,